Now, according to the United Nations Secretary General Antonio Guterres, gender equality and women's rights are essential to getting through this pandemic together, to recovering faster, and to building a better future for everyone.
Well, as Nigeria continues to tackle the COVID-19 pandemic, caring for women and children during this period seems to be inevitable.
So joining us to talk about this and more from our Abuja studios is Dr. Amina Aminu Dorayi, a physician, a public health professional with extensive experience in designing and managing public health and social development programs aimed at improving the lives and well-being of women, children and families.
Well, Amina's dedication and commitment earned her numerous local and international recognitions, including the Award of Excellence, Innovation and Transformational Leadership from the Partnership for Transforming Health Systems Phase 2 project, the Clark Apt Award for Outstanding Social Impact in Maryland, USA, and the Woman of Influence Award from Life Changers International, UK. Thank you so much, Dr. Amina, for joining us this morning. Great to have you on the show.
Thank you very much for having me.
Indeed. Let me begin with the general response so far. Do you see a gender-inclusive response by the Nigerian government to the COVID-19 pandemic? And if not, how important is it for us to have this conversation and have a gender-inclusive response to the pandemic?
Thank you very much for your very interesting and important question. So for Nigeria, it's actually not specific for Nigeria. Globally, the response to this COVID-19 pandemic has not really carried the issues of women as it should. The first thing is that most of the task force members, and I say globally again, and in addition to Nigeria, are actually made up of men. And we know that more than 50% of the population globally are made up of women. So it's a surprise that if you have more men on the table, they will not be able to really respond to the issues of the other gender, and that is even what everyone knows. So in terms of what should be done for now and in Nigeria and across the globe, specifically, women need to be at the table to discuss the issues of women and the impact this pandemic has on their gender. One of the important things is that we know even without the pandemic, the issues of women are really unique, and we have to have a gender lens to everything, not only this pandemic. It shouldn't be an emergency response. It should be part and parcel of our system, that women make up 50% of decision-making body and make up 50% of those that are actually in the response of every particular condition, especially something like this pandemic, which affects women as much as men. One thing we need to know that, the statistics shows that mortality is higher in men for COVID-19. But we need to know that it's not only the mortality. In general, COVID-19 affects even women much more because the indirect consequences of this pandemic that may not even be seen now, but it may be seen in the next couple of years, where we would be able to have reached a situation where we will not be able to return to normal. One instance is that, women actually have the most caregiving responsibilities in every family. So you can see that because of that, some of them are actually afraid to even present themselves to be tested for COVID-19. And why do we say that? It's because when they think of the consequences of being positive, which means that they're going to be away from their families for at least 2 weeks in isolation, they would be afraid of presenting themselves, because who would take care of their children? Who would take care of their families? Unfortunately, the caregiving responsibility is really focused on women, and the burden is so much more than we think. So some of these issues are the reasons why we do not even see women coming out to test and to even be able to be part of this COVID-19 pandemic. So, yeah.
Right, very, very apt point you have made there. But Dr. Amina, I want to talk more about children, because they're sort of intertwined. You can't talk about the mother without talking about the child. And I want you to, regale me with very important information as regards, bringing children into the conversation. We live in a stark continent with very high numbers. Infant mortality is quite high in Africa. You know, death of children under the age of 5 is quite high. A lot of children die more from diseases like pneumonia in Africa than other parts of the world. A lot of children don't have access to basic nutrition. Vis-a-vis the United Nations Sustainable Development Plan to be able to help children and mothers and other, people across the African continent. Coupled with this is COVID happening now. The African director for WHO did say 190,000 people will die in Africa. Most of them are children. What do you say, and what would you say about inclusion of children?
Well, thank you very much. Actually, you've said it, that the major challenge we're having as a country, let me talk about Nigeria, is that we do not have systems in place that are deliberately, responding to our context. Why I say that is because maybe let me use the issue of Almajiris. The Almajiris that are the children of the streets in northern Nigeria has been with us for a very long time. This is not new. But because of this pandemic, you can see that their issues are now brought to the fore, and governors and even decision makers are even trying to send them from one state to another to say that they should get back to their homes. So I think that these reactive measures, even though they are part of the measures, but they are really reactive, and we are not hitting the nail on the head. These children have left their homes for a reason. They left their homes because probably their parents are not even able to cater for them. And that gets me to the point of family planning. Even if we do not want to hear that, at least if our mothers and our wives and our families are embarking on family planning and ensuring that they're having the children that they can cater for, at least there will be some level of, response to this pandemic will not be a big issue. For children, I would like to look at children in two levels. One is the children that have homes that are maybe in Abuja or Lagos or some of the larger cities, and which to me is actually referred to the screensavers of Nigeria, because that is not really the condition of most of the children in our rural communities, and they constitute more of the children that we have in our country. So for the children that are in more, urban communities, you have issues that for now, education has stopped. With this disruption in their education, we do not know what is going to happen. And we know that some of these things can affect their mental health. They will have so many questions to be answered, and unfortunately, we do not have all the answers. The scientists do not have all the answers, neither do the policymakers have all the answers. This is a novel disease. We're trying to learn as we move, and it may have a huge impact on the psyche of our children. But then let me talk about the more rural children who constitute the majority of our country. The preventive measures that we know and that are very common for preventing COVID-19, for instance, include hand washing, keeping a safe distance or physical distance, between people. But the way that our societies are even, arranged, most of our houses in the rural areas are in squalors. So many people live in the house, and we are sure that, how do we expect children and, other even adults to embark on social distancing or physical distancing when they do not have the appropriate space to distance? But the other thing is that we do not have facilities for water and sanitation. Most of the states or in the communities that in this country do not have running water or potable water. How do we say people should wash their hands regularly with soap and water? I think some of these issues need to be systemic. We need to consider responding to them as a system. This pandemic has made us really realize the challenges that we have always had. But because of that, it is even more so at this period that it is becoming so critical for us to respond to our health system and also our economic system and all our system issues. But then also looking at children, as you say, other diseases are not going to stop affecting children at this point. Malaria is very common everywhere. Pneumonia, as you say, malnutrition. And for malnutrition, it is even more so now that parents and caregivers, most of them are out of their jobs, are not able to make a decent living because a lot of our people depend on a daily living or daily wage. Most of us are even in the informal sector. They are not part of the formal sector like you and I. So how will they be able to manage themselves in a lockdown? They will not be able to go out at any point in time to care for their families. And this affects children. So malnutrition would even be more at this point with this lockdown or with the restriction of movement without even looking at all other conditions. And again, another thing is the vaccine preventable diseases, measles, for instance, meningitis. It's the hot season now, and children will be prone to meningitis, and even adults. But unfortunately, with the health system on, should I say, a little bit of relaxed mode, because people are not even attending the facilities. And even if they do, our health workers, rightly so, are quite afraid to, to serve people and serve clients and patients, because they do not know who has COVID-19 and who doesn't. And probably most of them do not even have the PPEs required to take care of COVID-19 patients, or even any patients, for that matter, that have infectious diseases. There are many transmissible diseases, but because COVID-19 is highly transmissible, that's why we are worried about it. But the issue is that it's multisystemic, it's multifaceted. If children are sick and their parents cannot take them to the hospital either because they do not have the resources at this point, or the health service is really down or working at suboptimal level, and all the resources that we have, both financial and human, are concentrated on fighting the COVID-19 pandemic and the response to COVID-19, honestly, it is really a big, big challenge, and we're taking ourselves to a level that which we will not really like. Another thing is that the mortality now and the morbidity caused by these issues will now be higher, even more than the COVID-19 itself.
Definitely. A lot of salient points that you've made there. However, this pandemic seems to be deepening. Okay, we're going to go on a quick break, Dr. Amina. And when we come back, I will ask you my next question. Join us again. Welcome back to the morning show here on Arise News. We're still joined by Dr. Amina Aminu Dorayi, a physician and public health professional with extensive experience in designing and managing public health and social development programs. Now, we have spoken about children, but I want to bring the conversation back to the women. Now, we can see that this pandemic seems to be exposing pre-existing inequalities as well as social protection structures. Even the United Nations, they come out to say that about 50% of progress that has been made with women and children has the tendency to be rolled back during this COVID-19 experience. Now, my question to you is, when we look at the situation of domestic violence and abuse, we did see a rise during the lockdown and even during the partial ease of this lockdown. So how do we begin to ensure that we protect our women, especially at a time like this?
Thank you very much. This is really a very a good question at this critical period of our lives, and humanity is actually at stake. So, as you rightly said, the UN, United Nations, has actually really brought this issue to the fore. For Nigeria, I have actually been worried about domestic violence or gender-based violence also, even for some years back, because we have seen a huge rise in rape, and including the rape of young people, young children, including boys and girls as well. We have seen that rise in the recent times, but more so during this pandemic. You see, one of the issues that, some of the issues that exacerbate this gender-based violence or domestic violence include stress. And during this period of lockdown, there's, we know that stress is really very common. Another area is also on alcohol consumption. Many people that don't have much to do, of course, they get into alcohol or drug abuse or misuse. And that is also another exacerbating factor for gender-based violence or domestic violence, which is also common during this time of stress. But the main issue is also the financial disparities or the financial challenges that we have. A lot of men and even women cannot handle the issues that we're having on the financial stress that we have. And this is also another trigger for gender-based violence and domestic violence. So the challenge now that we have in the country is that both women and children are very negatively affected. And, you know, for some of the women that are able to step out of their homes, maybe before this lockdown, before the pandemic, they could go out, you know, and look for their daily bread and actually be away from the perpetrators for a long period of time. That was a saving grace. That was a kind of a social safety net. But now that everybody has to be at home, and we know that for gender-based violence, for domestic violence, the perpetrators are more people that are within a family, people that are well known. So it means that it has to be exacerbated at this point because most people are living together. And, you know, that's why I say the social security system that we have in the country has to be deliberately targeted towards responding to these systemic issues, not only during a pandemic. If we had structures in place to be able to identify perpetrators, which I'm happy that sometime last year we had the register for those that are supposed to be, when you find someone that you think, you know, is one of a perpetrator, you can actually, should I say, get their names and into that register. But you see, now, I don't think most of our rural women and most of our families are aware of some of these things. What we need to do is to be more active and more proactive in sharing this information and also helping them to also have services in place. In addition to other services, maternal health services and child health services, gender-based violence response services need to be in place in our health facilities. And again, unfortunately, as I said earlier, because most of the response and most of the health system is now focused and targeted towards the pandemic, even issues around gender-based violence may not be a priority for our health system, which has to have a systemic issue around it. And it's a really big challenge, as you say. Yeah.
Well, talking about priority, Dr. Dorayi, are you worried and do you have concerns that issues of reproductive health, maternal health, sexual education for the girl child, and treatment of HIV and AIDS, as well as prevention, may be relegated increasingly in a time like this? And what is your organization, the Pathfinder International, doing to close this gap or cushion the effect?
Yeah, I think that's a very good question. We are all, in fact, I think everyone, especially those that work in the health sector and in public health space, we are all worried about the impact of this pandemic on women and children. And for women especially, we know that women, because they have the burden of caregiving, as I said earlier, and, you know, pregnancies are not going to stop. In fact, there's going to be probably a boom in pregnancies and in deliveries in the next couple of months due to this lockdown, due to everybody staying at home. So the first thing is that we all know that, as you know, women are at every point in their life cycle, they are in need of some critical services. Before, when they are young and probably before marriage or in between pregnancies, most of the women that we have usually are in need of family planning or contraceptive commodities and services, and information as in addition to the commodities. But we know that during this time, even the supply chain for commodities like family planning would be disrupted, not only locally, but even globally, because of the issues of, you know, closing down factories and all. And there will not be, most of the time, this is not even a priority in some of our government parastatals and government facilities, unfortunately. And then with this particular period, family planning and reproductive health commodities are really going to be a big issue for us. But then again, as I said, because pregnancies are going to continue, it means that most of our women will need antenatal care, would need delivery care, would need postnatal care. Our children will need vaccinations. And with the system now, as I also said earlier, all targeted at the response to COVID, these other conditions will not go away. And unfortunately, we may have even higher maternal morbidity and mortality as a result of the indirect consequences of COVID-19 that we had before. I think, you know, as a country, data is a very important issue in Nigeria. We need to have data to learn lessons from this pandemic. what is it that we have done well and what is it that we need to improve on. While we are focusing on the response to the pandemic, what other essential health services like family planning, antenatal care, delivery, postnatal, child vaccination, and any other chronic diseases too as well, what are the impact of those illnesses on the health system and on our individuals. So it's clear that I'm really concerned. As you asked earlier, I'm very worried and concerned, and I think that we need to do much more in trying to reduce the impact that these issues may have on our women and our girls. And again, domestic violence, yeah.
Go ahead, please. Just go ahead, doctor.
Okay, thank you. Yeah. So again, for domestic violence, both our young girls and women being at home now, the unfortunate thing is that already they are even afraid of going to present themselves because of the stigma related to this domestic violence and gender-based violence, and also our community institutions are not helping matters. I think these issues should now, more than ever, be at the front burner of community discussions, religious discussions, and also health system discussions. It is not a crime for you to come out, even during this pandemic, to say that this is, you're kind of you have been affected by gender-based violence. You are a victim of gender-based violence. But without a health system that is ready to respond to these other conditions, we will not be able to cater for our women and our children. And at the end of the day, it means that we'll have, as I said, more morbidities and mortalities related to other conditions because of the indirect consequences of COVID-19 as a country.
Okay, Dr. Dorayi, very excellent point you've made there. But I just want to touch on two quick issues. The first one is a lot of sexual violence is going on. How do women get to report men like this so that they can get on the sex offenders register? Because it looks as though there are many predators out there walking the streets of Lagos and other cities that are not on that register. And how can we take action as regards that, especially when there are people in power? Because we've seen cases like that. The case of a particular senator comes to mind, assaulting a woman that was caught on camera. That case was just left like that, and the senator is a free man today. Secondly, this scourge of COVID is going to take a big toll on us. I remember a couple of years ago when Ebola struck. In some parts of Liberia, there were the children we call Ebola orphans. They lost their parents due to Ebola. In Nigeria, as the case is increasing, we might have COVID orphans. I mean, I've lost both parents to COVID. How do we take care of these COVID orphans that might emerge from this crisis? Just two insights, please.
Okay, thank you very much. And I realized that I did not answer the other question about what Pathfinder as an organization is also doing to kind of curb some of these challenges that we have. So Pathfinder International actually has been working in Nigeria for the past 55 years, and we make bold to say that we are one of the few NGOs that have been around even during issues that Nigeria had for the military regime and insecurity and all that. So we're able to kind of pass that hurdle. So as an organization, what we do is to support the government and support private facilities, and we're a supportive organization. But because our focus and mandate is also targeted towards women's reproductive health and rights and other conditions such as HIV and resiliency in general for women and girls and also the families. So for Pathfinder, we have some of our projects that are supported by the Global Fund particularly. I'd use that as an example, where we work in the 7 northwestern states to support the stream or quality service delivery of HIV services. And in those facilities, we have a number of facilities in hundreds that we support in those states. With the lockdown, of course, there's an issue about, the access to those centers. But what we have done is to also have the ability to, we have built capacity rather in the facilities, whereby the health workers, they are able to identify cases that are presumptive for COVID and for them to be able to also refer. But another thing is that because we are talking about a condition like HIV where that reduces the immunity of people and they would be more at risk of infection with COVID-19, we are also trying to ensure that, one, the clients themselves do not have to come to facilities regularly, so we try to provide them with drugs and commodities worth about 3 to 6 months, so that if they have no indication for coming to facilities, they do not have to come.
All right, welcome back to the morning show right here on Arise News. We've got Dr. Amina Dorayi, a physician and public health professional. She's won a lot of accolades for the good work she's done as regards. So you were answering our question before we went on that quick break. If you just go ahead with that.
Yes, thank you very much. I think I'll also talk a little bit about the work that we support on gender-based violence. So for instance, a couple of years ago, we were supported or funded by the United States Agency for International Development, USAID, to also support some states to set up what we call sexual assault referral centers. So in the country, each state is actually supposed to have a sexual assault referral center where community members are supposed to come in to receive services that, especially victims of gender-based violence. So in these states, what we did was to identify a very viable, should I say, location, and most of it is either in the facilities, government facilities, or in private aid centers where it's going to be a sustainable location. So what we have done is to identify within the communities the members that will be part of these sexual assault referrals centers, and we trained them to identify gender-based violence victims, to be able to counsel them and also to refer them, to give them the initial response support, but also to refer them to other facilities or services if needed, like for HIV, for instance, and pregnancy and all the other areas that we need to make sure we handle. So in these sexual assault referral centers, they are still existing in these facilities, in these states that we have supported, and they are there to really support the public. But one of the things we also have done is to ensure that we have put the information out there. So even if you have a service delivery center, if the information is not out there in the public and they know that they do not know where to go to or where to access these kind of services, you would not see people come out. And another thing is the issue of stigma. So we have tried to also address the issue of stigma by ensuring that in those facilities where the sexual assault referral centers are, it's a facility that sometimes handles many other cases, so that it's not that if you come there, everybody will know that, oh, this person has been assaulted. And as part of the members of that committee, you have the police, the lawyers, and the healthcare providers. So it's kind of a very comprehensive setting where whatever service you need based on this gender-based violence or sexual violence issue, you'll be able to get that. So Pathfinder has supported those, and then I know that other organizations are also supporting the governments to set up other sexual assault referral centers across the country. But as I said, I think the information needs to get out there. We need to not be shy to talk about it, and to also encourage victims to always go out and present themselves, because it's not only about the mental health issue, for instance, it's also about physically how it can come and impact people. Some of them that will get pregnant as a result of these domestic or sexual assault will need services like, for instance, abortion care, that they will go out and look for services elsewhere that may not be safe. So this is a very challenging period for all of us, especially with the COVID-19 pandemic, that some of these services will not be, provided at optimum level. Yeah, thank you.
I mean, although
so can
children...
I have your question again?
Yes.
Right, that was one of it. That was just one part for it. I also talked about, children that are orphaned or that are going to be orphaned due to COVID. Is there anything being put in place for them by Pathfinder?
And just to add to that, ma'am, I mean, we know that although children's health appears to not be affected because they have better immune systems, the education systems are closed down. So what steps can we take to mitigate this psychological distress that this might affect on children and their families?
Okay, thank you very much. So to answer your first question on the children that will be orphaned as a result of COVID-19, Unfortunately, as Pathfinder, we have not really, that is not one of our major focus, but because we are part of the support team in the country of families in general, we are actually willing to work with the government and the private sector on this area. Unfortunately, as a country, I do not think we have the capacity, not only as an organization that is supportive of the government, as a government and both subnational level and national level, I'm not sure that we have any system to address orphans yet that are going to be as a result of this COVID pandemic. Of course, we have facilities that take care of children in many states, but these facilities are very suboptimal. Water is is a big problem there. Availability of potable water, the toilet facilities, sanitation, even the feeding. So as a system, that's why I always say that we should not really be reactive to this emergency situation. We should put systems in place. And I think that to answer your second question as well, as a government and as a nation, we need to be deliberate about the responses to not only COVID-19 or emergencies or pandemics, but to responsive to our context. We know that even without the pandemic, we have a lot of children that are orphaned due to many other conditions. Road traffic accidents, for instance, takes the lives of so many. HIV, cancers, and many other kidney diseases, for instance. And we don't have a structured system to identify these children and to also put them in a social safety net. I know that we are, going towards, social security in this country, but there are many things that need to be put in place. We are supposed to come as an organization, as a nation, both with the expertise of the private sector and also with their resources, and also the expertise of development partners and their resources, and then as a nation also our own resources and with the knowledge of our context. We are not really, to me, I don't think that we should just be copying what other countries do always. What we need to do is to try to create our own niche to address this systemic issue even before we have pandemics. So I hope that as a country, this is going to be a big lesson for us, that at least we should look at our context, look at all the social issues that are challenging us in this country: housing, water, sanitation, everything that is an indirect consequence that can affect health, what we call social determinants of health, in addition to the health system itself. Most of the issues that we have now in Africa and in Nigeria particularly is because our health system is not strong enough to even address the basic diseases that we have, not to talk of including adding a pandemic to our conditions or to our country context. So I think that we have to be deliberate about it. We have to all come together on the table. Women have to be involved, because some of these issues, as a woman, you will also be able to think out of the box, out of what a man would think of, for instance, to look at the family in totality as an entity and try to give solutions that are holistic. So I think we need to really be deliberate, both at the states and at the national level.
Okay, Doctor, we're out of time. I would have loved to ask you about the IDP camps, if you're beaming your light there, and if you are losing sight of the SDGs. But unfortunately, we have run out of time. But we do sincerely thank you for coming on the show today. Much appreciated.